Be good to share.
Yep.
All right. Welcome everybody. Really glad you're here. My name is Mike. I'm an account manager here at Documo for our white label customers. And alongside me, we have Sam, the director of our customer success team. We've put together this presentation specifically for our white label partners. And it's pretty simple. Hopefully, by the end of this, you'll be better equipped to help solve a real problem for your customers within healthcare. Little intro for Sam and I. My name is Mike. Like I mentioned, I've been with Documo for about a year and a half, but I've been specifically focused on our white label partners for about 6 months now. And I am from Chicago.
Yeah, and
Sam,
I'm Sam. I'm the director of customer success here at Documo. I have been with Documo. It's 6 years as of June. I'm also in Chicago, and yeah, I think I've worked with our white label partners for the majority of those 6 years. So really kind of familiar with a lot of your problem sets and that kind of thing.
so So before we dive in, we'd love to hear from you in the chat. What kind of customers are you serving, whether that be a medical practice, a health system, EHR, or even something else? But not just the kinds of customers you're serving. What types of documents are they processing today, whether that be lab results, prior auths? It'll help kind of shape the conversation that we had during this presentation today. So we'll go ahead and give it a couple seconds here, a little bit longer to hear what you guys got to say. Here or anybody in the chat here? Well, I can keep moving while people throw in some answers here. So, just to kind of go over the agenda for today. So, here's what we've got for you. We're going to start off with a quick facts trivia round. So, stay tuned. Shortly, there's a $50 Amazon gift card on the line. We'll then walk through the document management problem your customers are facing today, which is something that's very manual. And because of that, there's a huge expansion opportunity because of the current issue that is manual document processing. We'll then introduce IDP and what that stands for, what it does behind the scenes. And then Sam will go into a live product demo of IDP. We'll also discuss how you can sell this into your customer base and then finish things off with some Q&A. So with that, let's go ahead and kick it off with the facts trivia. So I think Rachel here is going to throw in some questions you should see on your screen right now. We'll give that a minute or so. I see some are answering right now. Um, you guys can still answer. I'm gonna continue to go on, but feel free to continue answering this quiz. I think I mentioned, as you can see on the screen, there is a $50 Amazon gift card, so you are going to want to try to take advantage of that. I know we've got Prime Day coming up here in a few weeks, but I'll go ahead and move on. So the problem that customers are facing today is a very manual process, right? So fax comes in, could be from a lab. Oh, got to move this poll here. Give me one sec. It could be from a lab, a referral, a prior auth, but someone on that staff has to open it, right? They have to figure out which patient it belongs to from that fax. They have to then pull that patient up in the EHR, classify the type of document it is, right? Lab, referral, prior auth. And then they've got to extract those fields manually, right? Read, copy, and paste them, and ultimately transcribe it into the EHR. And this six-step process right now is taking roughly 5 to 8 minutes per document. So when you think about a practice that is processing 50 documents a day, some may say that's a lot, some may say that's nothing. But even with just that example of 50 documents a day, you can see how that really adds up time. And it's just a lot of manual data entry for the staff, your customers and their staff having to just focus on doing that manual data entry. So before we wanted to, try to solve for this problem, we really wanted to hear from healthcare professionals on what the problem is and what they're looking for. And so this isn't just from one practice or one vertical. We surveyed over 100 healthcare professionals, and 58% say fax related delays directly impact patient care. This isn't just taking a long time to process. It's not just increasing the chance of human error, but this is also impacting the care that patients receive. And I think you can see that this is a problem that goes well beyond fax. And, I'd say any healthcare professional or most of them would want to solve for something like this, right? They want to mitigate any chance that there is on a negative impact on patient care. Next, we've got 90% that name automation as a top priority, yet only 29% have fully automated fax workflows today. So that's less than a third that are looking for automation as a top priority actually have it implemented. So there's a huge gap of a little over two-thirds that are looking for something to help automate a process that is very manual today. And that's where you're going to be able to come into your customers with a solution that we dive deeper into later on. Some other statistics here. So 53% of inbound documents are flagged as urgent, right? More than half. These aren't documents that can wait and sit around for a day or two. These are lab results. These are prior auths. These are medications that need to be processed quickly. And when they sit in a manual queue waiting for someone to get to it, that's when the care gets delayed. That's when patients feel it. And that's when the impact of patient care comes into play. Similarly, 52.5% of inbound documents require manual handling. So at that, even when parts of the workflow here are automated, right? We saw that only 29% have fully automated workflows. But when maybe you have parts of this process that are automated, but when it's not fully automated, that brings in more data entry, more time to process these, and the chance for someone to make a mistake. And that mistake has a cost, right? Whether it's a misfiled document, a wrong patient match, a prior auth goes to the wrong chart. These are small errors in healthcare that aren't just inefficiencies, they're liabilities. And that again goes back to impacting patient care in a negative way. And so 57% say delays due to that manual processing is often or always hurting patient care, right? Not sometimes, that's always or often. That's the majority of your healthcare customers right now dealing with a problem serious enough that it's affecting the patients they serve. And I think this is something I think most healthcare professionals are going to want to solve for or try to mitigate if it's having a negative impact on on the care that their patients receive. So, at the end of the day, regardless of what you do in healthcare, getting the right care is what's most important. And we would want to mitigate that through automation and not having human error element into it when they're spending 5 to 8 minutes processing a document. Another stat here is 95% rate document processing as a top priority. So similarly to one of the slides I went over previously, where 90% are looking for automation as a top priority, there's also 95% that are looking at document processing as a top priority. And so if we think about those two things together, we now have automated document processing that is a big priority for our healthcare customers. And so how do we solve for this problem with automated document processing? Well, here at Documo, we don't call it automated document processing. We call it intelligent document processing. And you've probably heard me say IDP a few times. Let's dive into what IDP is and what it does behind the scenes here. So as you can see, everything in the purple box here is what goes on behind the scenes with intelligent document processing, right? You receive a fax, and then it kicks off the AI piece of this. So we run OCR, which is optical character recognition. We're able to turn that fax into readable text. And then a feature we've more recently added is split detection, right? So sometimes what we've seen from customers is they'll send a batch fax. Maybe it's separate faxes for different patients, or it has an end destination in the EHR. We're able to identify that through split detection and ultimately separate that up. The next step would be identifying that document. And we train a model so that we're consistently getting more accurate when a file comes in or a fax comes in, right? Is it a lab result, medications, whatever that form is? But then we also need to extract the key pieces of information that are within that fact, and then ultimately get that information and match it to the right patient in the EHR. So I kind of went over what the process looks like with that six-step process earlier on. But the big difference here is, yes, there's still a human validation component to it, right? We want to make sure the extracted fields are accurate. We want to make sure we're finding the right patient. And that all takes a few clicks of a button. But you're talking about prior without IDP, it's a process that is taking 5 to 8 minutes with many steps where there can be human error because of the amount of data entry fields that happen or that are required rather. Here, even though there's a human element in validating all of this, we're cutting that 5 to 8 minutes down into seconds. And that's something that is going to give your staff time to focus on other things that are more important than just data entry, right? And so before we kind of dive into a live demo, let's take a step back and ultimately look at what's the current workflow today without IDP? And then if you implement IDP, what does that workflow look like for them after it? So here's what it looks like. On the left is today, right? The fax inbox is a pile of PDFs. Staff has to open it manually. As I mentioned a couple times, it's roughly 5 to 8 minutes per document. And the other thing too, because of that 5 to 8 minutes and the number of different fields that ultimately need to be transcribed, there's a higher rate for human error there. And as I've mentioned a couple times, the higher rate of human error can lead to harming patient care, and nobody in the healthcare space wants that to happen, especially through fax. Um, Another important piece here is there's no audit trail at the field level. And I think one of the most important pieces on this left-hand side is your fax volume is directly correlated to the burden that exists already for the staff dealing with faxes, right? The more faxes come in, the more time it takes, 5 to 8 minutes per document. So it's really adding on to that burden that we're trying to solve for. However, on the right, with IDP layered on top, nothing really changes about how the fax arrives, but now documents are auto-classified on arrival. The patient match happens within seconds, and we can push the relevant pieces of information from that fax into the EHR automatically. So there's a full audit log on every extraction. And again, the big piece here that you're going to be able to bring to your customers is you're now able to scale the volume that you're processing documents without adding that burden of more time, higher probability of human error onto things. And so again, this gives your customers and their staff a lot more time to focus on things that are more important than manual data entry. And so with that, I'm going to go ahead and kick it over to Sam to do a live demo. Um, and I think we're going to have some questions after that. But Sam, go ahead and take it away.
Yeah,
Let me, yeah, stop sharing my screen.
thanks, Mike.
Good.
Yep. All right, let me make my screen bigger. Okay, so I'm inside of the Docimo platform, and as you can see, I'm on the send fax screen. This is just a screen that you'll land on when you first log in. We have a new component in our web portal called Workspaces, and Workspaces is where all of the IDP processes that Mike went over are housed. So if I click over to Workspaces, you'll see we have a number of workspaces already set up. I'm going to search for one that I'll give the demo on. If I click into Edit Workspaces, you can see what happens to a document when it lands inside of the workspace automatically. So just like Mike pointed out a little bit earlier, when a document lands in this workspace, we'll automatically run optical character recognition so we can pull out the full text from that document. We'll run classification so we can classify what type of document's being received. We'll run extraction so we can pull out some of those patient identifiers. Um, and then we'll also run split detection. So that way, if there ever is a document that has, multiple patient charts inside of it, or what have you, we'll identify the breakpoints and give a suggested um, break for those documents and then do that automatically. And then we'll also retain a document for up to 365 days by default inside of this workspace, but that's customizable. So if you wanted us to retain it for less than that, you can set that up here as well. We also have the ability to see which users have access to this workspace. So when you're setting this up in a healthcare setting, you may have one workspace set up by clinic, by department, by number even. So you can really kind of customize who has access to the shared space and give them invites. An admin can control who has access to what, and the users will only see the workspaces that they're assigned to. So there's no risk of, a data breach or anything like that by having someone have access to sensitive data information that they don't need to have access to. And then the data sources tab is where you can add in inbound fax numbers to have this IDP process automatically kicked off. If I go into the workspace, you'll see that you can also upload files. And for the purposes of this demo, I'm going to upload a file. But as inbound faxes come in, they will have IDP automatically ran on them. You'll have a copy of the fax created inside of this workspace with the actual fax being stored inside of the fax history. So I have a number of documents that have already been uploaded into the workspace, but I'm going to go ahead and upload another one. And as you can see, as a document comes in, there's automatically a new tag tagged here. Um, as the IDP process is being ran, you can see that it's being identified as an advanced directive type. And if I click refresh, the patient name doesn't want to update for some reason. But if I click on the document, I'll pull this up. I'll go on this one. Um, you can see that we pulled out the patient first name, which is Betty Ann, patient last name which is Thrash, date of birth. And then if you scroll down, we also pulled out date of medical encounter. We have a number of custom extracted fields that aren't reading anything in this document because it doesn't exist inside of this document. But if there are specific fields that are needed from your customers, we have the ability to set up custom extraction to pull those out as well. Um, and then the final step here would be if I click on the Send tab, we have a number of EHRs that we integrate with. So if I click Start Over, we currently integrate with Point Click Care, we integrate with NextGen, and we integrate with ModMed. We are building an eClinicalWorks integration shortly, and then there's a number of other EHRs that we will integrate with by the end of the year. So you can send those directly to those EHRs, but for the purposes of this demo, I'm going to use Point Click Care. Once this loads, we can actually run a patient lookup inside of Point Click Care to find the patient inside of the facility. And then what we can do is we can automatically push this over into the patient's chart inside of Point Click Care. So this document was for Betty Ann Thrash. This is filling in correctly with the right date of birth. And you can see there's a corresponding patient inside of my Point Click Care instance. So if I click that, I'll just select the category, and this is advanced directives. Once we click finish and send, this will be sent over to Point Click Care. So like Mike said, you're taking a 5 to 8 minute process and really kind of condensing it down to about 30 seconds to a minute per document. And you're also still having that human in the loop element so you can make sure that the data that is being sent over to the EHR is still accurate. The difference is instead of manually transcribing everything, it's just a review process. And if I go over to Point Click Care, and refresh, this will arrive inside of the miscellaneous tab, and it should show here. That's typically where these land, and then you'll see the categories will populate as well. Any questions from that demo from anyone? Great. Well, let me jump into the back end of the presentation. Okay, so now that we've kind of identified the problem, we've identified what the solution is, how are we changing our sales pitch and how are we moving from, selling mainly to price with fax customers, to shifting to selling the whole value of the Documo platform? Um, Many conversations when you're dealing with a fax only conversation. They're really fixed on per page bidding wars. And this section is really kind of meant to reframe them first on facts and then to reframe with IDP. So first things first, why do partners typically lose fax deals due to cheaper vendors? Most fax conversations follow a predictable path and they end in the same predictable way. So here's just kind of an example of what that looks like and how to kind of avoid the trap. So first things first, you'll often have a prospect or even a current customer come in, and when they're up for renewal or if they're shopping for a fax vendor, they'll request quotes from a few vendors, right? Without really being able to give your pitch. Um, if you are just submitting a quote, you typically will not, submit the lowest per page cost, right? The comparison that the prospect is making is on just purely a cost basis. And then number two, you're being kind of forced to defend the gap. So you're already playing defense if you're framing on just a per page basis and just a cost basis, right? You're spending the call explaining why your price is higher. Even if you're winning, the prospect has been trained to treat fax as a commodity, right? Um, and then typically this ends in two ways. So number one, you win the deal, but you kind of lose the account. So you're already going into it with the prospect treating fax as a commodity. They don't really see the value in the whole platform if they're just focused on price. The margins compressed, the renewal's already at risk, and there's not really much room to expand into anything bigger just because you've been positioned as a fax line and not as a partner. Or the more common outcome here is the cheaper vendor will just win by default. The prospect might just go with whoever quoted the lowest number. And since we're just positioning this based off of pricing, you're not even getting a fair hearing of the differentiating platform, the whole value set that Document kind of brings to the table that some of our competitors don't.
We did have one question that came up.
Oh, sure.
Um, so what's the recommended way to introduce IDP to existing fax customers? My recommendation would be the best entry point is the fax workflow itself, right? If a customer is already receiving faxes, the question becomes, what happens to that document after it lands? If somebody's manually processing that, manually reading that, or typing in data somewhere, that's where your intro is into IDP. But we also can offer email copy from our marketing team, some marketing materials, and also assist in a outreach campaign. So um, definitely a few different avenues to introduce your customers into IDP through the conversations you're most likely having already.
Yeah, thanks, Mike. And I'll kind of touch on that a little bit later in this presentation as well.
Um,
Um,
yep, go ahead.
Great. So how are we reframing this pitch? We are looking to reframe this from really just a utility, so treating fax as a commodity, to more of a workflow partner. As Mike mentioned earlier, a lot of your healthcare customers are already feeling this burden. A lot of your healthcare customers are overwhelmed with the amount of inbound documents that they're receiving, and they're looking for something that can do what we are offering. Um, if you are just selling fax and you're just comparing on dollars and cents, you're really going to kind of sound outdated. You're going to kind of sound like someone who is just saying, "Hey, we're cheaper than your current vendor. Hey, if you sign a 3-year deal with us, we can knock 10% off." By framing this as a whole workflow and framing this as a platform rather than just a, fax line, you're selling a platform that starts with fax and really kind of allows healthcare teams to add in the document automation whenever they're ready. And it also speeds up that process and they can see some time savings and actual ROI, which we can get into a little bit later in the presentation.
Also got one more question, if you don't mind.
Sure.
So is there a pilot or a trial structure we can offer for customers before they fully commit? We don't exactly offer the pilot, but yes, you can start on a usage-based plan so your customers can see the value that IDP provides. We understand that this is new, so we want your customers to see that value before committing, their full usage into IDP. And another thing is, for our white label customers, we do offer a 20% off retail price. So you can offer it to your customers, with limited risk.
Great. Thanks, Mike. And that really kind of segues nicely into this next slide. So how does IDP change your margin in your pricing structure? Right now, Fax is sold on a per page basis. We sell IDP on a per process document basis. You can really kind of set that markup, and by default, Mike just mentioned it. We offer a 20% discount just on the usage-based plan. So you already have that 20% margin that you can build in and sell to your customers. You still have the same billing relationship, which makes it really easy to add this on and offer your customers. Um, but it does offer a much greater per unit revenue cost than some of your customers, some that you might be getting from your customers today. Um, if you're dealing with just a fax only customer, typically our white label resellers are either passing through those costs or they're getting really little margin on them. Fax with IDP, you can kind of reframe that conversation as a workflow automation investment, essentially. You'll have that built-in 20% margin on IDP, but really kind of the markup is yours to set depending on the savings that your customers will see from the time to process, from the lack of, referral leakage if they're receiving referrals in their workflow, etc. Um, Fax plus IDP is much stickier and it's much easier to defend at renewal also, because if you have this built-in workflow, it's much harder to replace than just replacing a fax vendor. So with that in mind, in our account books, who are we calling first? Who are the best fits for IDP inside of your existing customer base? Number one, we're going to suggest that we focus on the healthcare vertical, which is something that we've kind of been discussing this entire webinar. Um, from our experience, we've seen clinics, specialty practices, anyone in kind of post-acute labs or imaging as the low-hanging fruit, if you will. Anyone that really kind of processes PHI on every page are the easiest ones to get this in front of. Um, they're the ones that are experiencing the burden. They're the ones that can benefit most from the time savings. And they should be the first ones that you call in your account list. Second, second to that is anyone that is processing a high amount of inbound volume, and they're likely still in that healthcare vertical. They'll feel the pain most acutely, and they will be most receptive to the benefit that IDP can bring them in their workflow, and all the time savings and kind of everything that Mike touched on earlier. Um, Also, an easy way to introduce this is anyone that's up for renewal. Work this into your renewal conversations, and kind of reframe that story if you are being pressured from, hey, I'm going and looking at this competitor that's offering me this fax price. You can really kind of re-anchor the Documo story that you're selling to your customers as a workflow tool rather than just you're just selling fax to them. And then also something that we've noticed is anybody that kind of fits the healthcare vertical that are dealing with high page volumes that have multi-location accounts. Document pain just kind of compounds as you add on locations. And we can kind of standardize that with IDP and make it a really straightforward process for them to process these documents as they're coming in. So here are two different pitches that you can give to one to a fax conversation and two for an existing customer IDP upsell. These will work. Number one will work against a cheaper vendor, and then number two is a great way to just introduce it into an existing upsell conversation. So number one is, hey, I know you're comparing fax vendors on price. We can be competitive there. But the reason that healthcare teams move to us and stay is that with Fax, Documo becomes the on-ramp to your whole Documo workflow. Um, we have, an EHR integrated audit-ready solution with your document automation that you're already using. You're not really buying a fax line, you're buying the last fax migration you'll ever do because it has a full workflow. And that typically opens the door for these conversations and kind of reframes it a little bit. Um, Same thing on the existing customer side is, you're already paying us to move documents. Right now, your team is opening each one, finding the patient, and typing them into the EHR. It's 5 to 8 minutes per document. We have a new layer that does that automatically. It's the same fax flow, but the data lands in the EHR on its own. And then you can kind of lead with, most customers free up a full-time employee in the first quarter of implementation. Um, that's usually a great framing to land into an IDP upsell conversation as well.
Yeah, got a really quick, Sam. Got another question here.
Uh-huh.
So what support does Documo provide during our first IDP customer launch? Actually, a lot. So we're pretty hands-on early. We understand this is a new product, but as your account manager, I'll be directly involved in your first launch. We're helping scope the workflow, make sure we fully understand it, get the document type configured, the model trained, and ultimately making sure it's working before you hand it off to your customer. But we also have a full implementation team here to assist. So we can be very hands-on if you want. We can be very hands-off if you'd like to, but we do have a lot of resources to make sure you can hit the ground running with your first IDP customers.
Yeah, thanks, Mike. That's a great point. And then a little bit more on selling to value and not price, right? Whether you're pitching fax or IDP, the same shift wins the conversation. Just focus on stop defending the price and start defining the value that you're providing to your customers. So the value conversation is really around, the time savings that IDP can bring to a healthcare clinic or, really anyone in that's processing these inbound documents. Um, Framing it that way, you sound more like a workflow partner. You're differentiated from every other fax vendor out there that this customer might be looking at. It's typically something that's already on the top of their mind anyway. They just don't realize it, right? They may not realize what the inbound fax burden is like until you surface it to them in this conversation. You're also anchoring on outcomes and not just on a per unit cost. It makes the conversation at renewal time much easier and defensible. Also, it makes it expandable over time as they bring on more inbound fax volumes. Um, and then here are four objections that we'll hear the most, two with fax and two with IDP. So number one, I think this is probably the most common that everyone will see. Vendor X is cheaper on price. We really just kind of have to reframe this on platform, right? They're cheaper because they're only selling fax. We're selling the fax line plus the IDP layer that makes the next 12 months easier. It's the same cost, just a different trajectory. Number two is, we've been with our current vendor for years. Why switch? I think we need to make sure that we're reframing that to risk. Most teams discover their old vendor was costing more than their bill. Unfilled faxes, lost referrals, support tickets, etc. Is it worth a 30-day comparison on your own data? I think also emphasizing there the switching costs is not the end of the world, right? If you're seeing better patient outcomes at the end of the day, it's worth it to invest there because that's also an objection sometimes. Number three is an IDP objection. Is the AI actually accurate? Can I trust it on PHI? I think we should lead with safeguards here. So we are HIPAA compliant and we're SOC 2 authorized as well. We have a full audit trail in every extraction and a full human in the loop review queue. You can also offer a low to no cost pilot on their last 100 inbound docs so they can try it out for themselves. And then number three is, we don't have budget for another tool. Um, this is a reframing it with a value add for freeing up a full-time employee's worth of work just by the amount of savings that they're seeing from a workflow perspective. Cutting that from 5 to 8 minutes down to 30 seconds to a minute should be enough to queue up that ROI conversation. And that's it. Any last questions for me before we hop off here?
Dude. Yep, sorry, I was muted. Yeah, one more question here for you, Sam. If we wanted to estimate the revenue potential across our existing fax customer base, is there a way to model that out?
Yeah, great question. So we actually have an ROI calculator built out on our website. Let me get to this really quickly. Okay. So this is fully on our website. This is available to everyone. We can drop the link inside of the chat. And this is just a great way to estimate the amount of time savings and labor savings that you can save with this IDP process. So the inputs over on the left-hand side here are the number of inbound pages received last month. We'll just use the default here as 50,000 pages per month. Maybe a little bit high, but even for teams that are processing less than that, it's still, you're still going to get a lot of ROI on them. Um, and then we'll estimate out the amount of minutes per document that is spent processing these inbound documents right now in a manual process. Typically, on average, we'll see anywhere between 3 to 5 pages per inbound document. So I'll bump this up to 4. And then typically we'll go through, how many full-time hours are spent per year processing these documents, right? And then what is the IDP time reduction that we're looking to save? So we'll be a little bit conservative at 50%. So we're taking that 5-minute process down to a 2.5-minute process, and we can just calculate the savings here. So you can see without IDP, we're spending about, 1,041 hours. Um, just on that inbound burden, right? You're spending hours and hours and hours. Um, with IDP, it's about 520 hours per month. So on the top here, you can see that we're saving about 6,200 hours per year, which is about 3.13 full-time employees that are freed from paperwork. And that's estimating this is just a 50% reduction. It's not even estimating it at what we estimated at in the presentation. So as you can see, this is a really powerful tool that you can bring to a conversation with a prospect or a current customer as you're having these conversations. Whether it's a facts first conversation and you're just kind of leading with this, or you're adding this in, or you're leading with IDP. This is a really powerful story, I think, that you can tell your customers.
Awesome. Any other questions?
Doesn't look like it from the chat. Great. Well,
Awesome.
if there aren't any other questions, thanks everyone for your time today. We really appreciate it. I think we had to announce the winner of the gift card. Mike, if you wanted to do that.
Yes, just waiting on who that is. So,
I actually have it. It's
oh,
Doug Guglio.
okay.
Congrats, Doug.
Congrats.
We will email you with the gift card after this. But thanks everyone for your
Congratulations.
time and really appreciate joining.
Yeah.
And looking forward to having some of these conversations with you all in the future. So if you have any questions about
Yeah.
anything or if you're interested in IDP, feel free to reach out to
Yeah,
me.
I'm the account manager for our white label partners, so please you should have my contact information, but if there's any questions that come up from this, please feel free to reach out and we can hop on a call or I'll provide you some answers to those questions. But really appreciate your time. And I am seeing from Drew, can we get a recording of today? Yes, we'll be able to send that out. I'm just not sure exactly when, but we'll work with our team to get that out to you.
Great. Thanks, everyone.
Awesome. Thank you. Have a
Bye.
great rest of your day. Bye.